A 17-year-old varsity wrestler developed a mysterious form of upright suffocation that baffled his coaches and teammates. This is what happened to his circulatory system. LV arrived at the emergency department presenting with severe respiratory distress that only occurred when he was standing up. While his team initially suspected a concussion from a hard fall on the mats, his vitals revealed a much stranger reality. His pulse was racing, but his blood oxygen dropped 10% the second his feet touched the floor. This is the physiological breakdown of how extreme dehydration and a minor impact unmasked a silent anatomical flap. LV is a 17-year-old elite athlete who had just spent 48 hours cutting 10 pounds to make weight for a tournament. To achieve this, he restricted his fluid intake to nearly zero and spent hours in a sauna, a practice that leaves the blood thick and the total circulating volume dangerously low. During his final match, he took a punishing double leg takedown, slamming his head and chest into the floor. While he was lucid and his initial oxygen saturation was a perfect 98% while lying down, the moment he stood to shake hands, his lips turned a ghostly shade of blue. This is cyanosis, a visible sign that the blood is starved of oxygen, causing the lips and nail beds to take on a distinct bluish tint. It is the physical manifestation of deoxygenated blood reaching the skin. Despite a clear head scan, every time LV sat up, he gasped for air. Doctors were facing a medical paradox. A patient who was suffocating only when he was vertical. In the emergency department, the medical team prioritized a neurological workup, assuming the impact on the mat had caused a brain bleed or a severe vestibular disturbance. LV was perfectly lucid, scoring a 15 on the Glasgow Coma Scale, which measures eye, verbal, and motor responses. A CT scan of his head returned negative for trauma, ruling out an intracranial hemorrhage, which is bleeding inside the skull that could have explained his sudden disorientation after the match. A confusing profile emerged when a nurse helped LV walk to the bathroom. His heart rate spiked to 150 beats per minute, a state of reflex tachycardia. This rapid pulse was the body's desperate attempt to maintain blood pressure as his brain sensed a sudden drop in effective circulating volume. This was his body's desperate attempt to maintain blood pressure despite a lack of fluid. Simultaneously, his oxygen saturation plummeted from 97% to a dangerous 84% within 60 seconds of standing. This is hypoxemia, a critical drop in blood oxygen levels that occurs only when LV assumes an upright position, signaling a severe posture-dependent deficit that defied the typical concussion narrative. By the time the cardiology consult began, the focus shifted from the brain to the heart's internal architecture. 25% of the general population has a silent patent foramen ovale, or PFO. Foramen means opening, and ovale refers to the oval shape. It is a remnant flap valve from fetal development that usually seals shut at birth. In LV's case, his extreme dehydration had reduced his preload, the volume of blood filling the heart, causing the organ to physically shift its axis within the chest. This geometric change, combined with a collapsing inferior vena cava, created a mechanical nightmare. The eustachian valve, which normally directs blood within the right atrium during fetal life, was now positioned to jet deoxygenated flow directly through that open flap. This created a wind tunnel effect where blood bypassed the lungs entirely, entering the left atrium still starved of oxygen. To visualize the scale, the heart was shifting by nearly 15 millimeters when he stood, a distance that seems small but is enough to completely realign the internal plumbing of a human heart. This rare interaction is known as Platypnea-Orthodeoxia Syndrome. This rare phenomenon is known as platypnea, a condition where the patient gasps for air while upright but finds instant relief when lying flat. Unlike typical lung issues where patients prop themselves up to breathe, LV was forced to the floor to keep his oxygen levels from plummeting. This postural shift suggested that gravity was physically rerouting his blood flow through an abnormal opening in his heart. This drop in oxygen, specifically when upright, is a phenomenon where gravity forces blood through an abnormal opening in the heart. While most people maintain consistent oxygen levels regardless of posture, LV experienced a sudden desaturation while standing that immediately corrected itself once he returned to a laying position. This explained why LV could only breathe comfortably when horizontal, as standing up literally warped his heart into a bypass machine. As LV remains upright, his internal chemistry begins to mirror a high-altitude crisis. Because the right atrial pressure now exceeds the left due to the mechanical tugging of his dehydrated vessels, deoxygenated blood surges through the open flap. This creates systemic hypoxemia that starves the vital organs, including the brain, which is why he felt a sense of impending doom and confusion. His brain, sensing this diluted oxygen supply, triggers a vasovagal auto-reset. This is syncope, a sudden loss of consciousness caused by a temporary drop in blood flow to the brain, which in LV's case was triggered by a rapid change in posture. It is the body's emergency mechanism to force LV into a horizontal position, where gravity no longer warps his heart's geometry. To confirm the shunt, doctors perform a bubble study. During this echocardiogram, microbubbles are injected into the vein. Instead of being filtered by the lungs, they are seen crossing the atrial wall directly into the left side of the heart. The right atrium had become a literal bypass for deoxygenated blood, allowing it to skip the lungs entirely. This occurred because his severe dehydration reduced his blood volume to the point that his heart physically shifted its orientation within his chest cavity. Seeing the bubbles cross the septum confirmed that the wrestler's heart was essentially skipping the most important step of circulation whenever he was upright. To stabilize LV, the medical team began with aggressive rehydration, pumping 4 liters of intravenous fluids into his depleted system to restore his blood volume. As his preload rose, the heart's geometry began to reinflate like a wilted balloon, pulling the atrial walls back into a more natural alignment. This increased the pressure on the left side of the heart, which helped push the PFO flap closed. However, while fluids provided a temporary fix, the underlying anatomical defect remained a risk for his next athletic season, especially if he ever became dehydrated again. To permanently solve the crisis, LV underwent a percutaneous PFO closure. The surgical team performed a percutaneous repair, a minimally invasive procedure where a catheter is guided through the femoral vein in the leg to reach the heart without an open incision. Surgeons navigated a tiny double-sided umbrella device into the heart, sandwiching the flap valve shut forever. Within 24 hours of the procedure, LV could stand up, walk, and even jog with a rock-solid oxygen saturation of 99%. The mechanical bypass was sealed. By avoiding extreme dry weight cuts in the future, he protects his heart from shifting again and ensures his blood volume remains high enough to maintain proper cardiac orientation. Thank you for watching. This case of Platypnea-Orthodeoxia Syndrome shows that even a minor impact can have major consequences when the body is pushed to its physical limits through dehydration. If this breakdown helped you understand the hidden links between hydration and heart health, please like the video, share your thoughts in the comments, and subscribe to Anatomy of a Mistake for more clinical stories. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.